I'm a student of um, Culminating Experience subject from the Port Hayes State University, and I'm going to present my study, and it is entitled The Impact of End of Life on the Emotional Health of Caregivers in Marshall Villa Residential Care Facility for Elderly located in Valencia, California. The study, so it is estimated that there are currently 20 million people worldwide who need some form of end of life care. In the United States, on average, 7,000 people die every day from various illnesses, and many of them must be under the end of life care. Marshall Villa is a residential care facility for the elderly nestled in one of the peaceful neighborhoods in Valencia, California. The facility welcomes seniors and those aging individuals with physical limitations. It also welcomes elderly needing end of life care. Their mission is to provide a caring environment that promotes peace of mind for each resident. Marshall Villa has been licensed to admit residents to hospice care. Those in hospice are considered as patients receiving end of life care. Before providing care to a resident who is wishing for hospice care services, one must secure that hospice care waiver was issued by the California Community Care. Marshall Villa has 6 care staff, meaning 6 caregivers, and 2 works during the daytime, and there are 2 relievers also. One is working during the night, while the other one is on call. This time, let me proceed to discussing the significance of the study. So it is important that significance be explained um, for the audience because this is a topic that is concerning people like the patients, the families of the hospice patients, and the caregivers, especially. Studies have shown that it's not only physical but also emotional experiences involved with providing care which can burden even the most capable caregiver. The physical and emotional states of caregivers need careful consideration by the employees themselves and the employers. This is what I have noticed in my experience as a care provider that many employers miss the point of like looking into the situation of the caregivers, just like how affected they are by the passing of their patients or like by the pressing demands of the job. So some of the experiences that caregivers are facing may face by taking care of a dying or what caregivers may face by taking care of the dying person include depression, mental decline aside from heart disease, diabetes, arthritis, etc. So these are the physical ailments brought about by say the stress that they've experienced from taking care of the dying persons, which I believe are things that should really be carefully considered. So the role of caregiver is incredibly important, but it is also very challenging. Caregivers' well-being is important because there are evidence that happy and healthy caregivers provide better support and care and potentially leading to better patient outcomes. So let me present to you the objectives of the study. These are the very things that I would like to achieve. First, to identify the demands of caregiving jobs affecting the quality of care that caregivers of Mashobila give to their dying patients. Second, to determine how end-of-life care has contributed to the caregiver's overall emotional health. Third, to determine how the caregivers cope against the loss of their patients. Fourth, to find out how caregivers' emotional health status changed following the death of their hospice patients. And last but not the least, to identify the qualities necessary to succeed as end of life caregivers. This time, allow me to present to you the definition of terms. It is important that the readers understand what is meant by the words that I frequently use during the in the entire study. So first, there's what you call end of life care. It is given to people who are near the end of life and have stopped treatment to cure or control their disease. End of life care includes physical, emotional, social, and spiritual support for patients and their families. The goal of end of life care is to control pain and other symptoms so the patient can be as comfortable as possible. End of life care may include palliative care, supportive care, and hospice care. It is also called comfort care. Now, let me proceed to define emotional health. It's very important. So, it refers to how a person thinks and feels. It is the ability to acknowledge and cope with both positive and negative emotions. So it is a sign of good emotional health if they are showing good emotions. Next is hospice. The term hospice is conceived as an end-of-life option for terminally ill patients. Hospices provide palliative care, medications, nursing services, and counseling for those diagnosed with 6 months or less to live. Hospice itself is end-of-life care that involves a team-oriented approach to quality medical care, pain and symptom management, and spiritual support tailored to loved ones' needs. Now, who are the formal caregivers? So, formal caregivers refers to a provider that is associated with formal service team, whether he or she is paid to provide services or volunteers. So, the formal caregivers, like the caregivers in Mashal Villa, because they are paid, so they fall under the classification of formal caregivers. Now, in case of the loved ones that take care of their dying relatives, they are called informal caregivers because they are not paid to do so. Let me proceed to defining terminal illness. Terminal illness is the state of being in the final stages of a fatal disease. A terminal illness is a disease that will result in the death of the individual regardless of any treatment intervention. This time allow me to present to you the methodology for my research. First is the research design. The research methodology used was the qualitative. So I thought that this is the most appropriate method that I should use for this kind of study. So qualitative methods are used to answer questions about experience, meaning, and perspective, most often from the standpoint of the participant. So the target population for this study was the 6 caregivers of Mashal Villa who took care of the hospice patients. So there were 6 caregivers in Mashal Villa whom I contacted and asked them favor if they could participate in this study. So one of them declined, which is totally understandable considering the seriousness of the topic, because not everyone is really comfortable discussing about, end of life or like the dying people, for reasons, okay, that I should understand. So data collection. Data was collected from the facility caregivers who take care of the admitted hospice patients through in-depth interviews using semi-structured or open-ended interview questions. Interviews are effective method to understand the perspective of the research participants. Sampling. Initially, a sample of six caregivers were considered. Like I said a while ago, one of them declined, um, and they only granted like phone interview because of their very busy schedule. Which I understood very well because considering their job as caregivers, they are, loaded with a lot of works to do during the daytime, and they deserve some rest during the night. So the interviews for each of them lasted about like 20 minutes. Let me lay down to you the research questions. So the first question is, based on your experience, how did the demands of your job affect the quality of care you give to your dying patients? Now, the second question I ask, how has end-of-life care contributed to your overall emotional health? Thirdly, how did you cope against the loss of your patient? Fourth, how has your emotional health status changed following the death of your hospice patients? And last but not the least, what qualities did you realize you needed to succeed as an end-of-life caregiver? I present to you the project outcomes, and I have all these things to tell you that these were all um, that I assessed after I read all of their responses. So the results of the study indicate that there should be proper scheduling and teamwork. Now, research question number one deals with the demands of the EOL job, which may affect the quality of care that end-of-life caregivers give to their dying patients. It is a common knowledge that it's not easy becoming a caregiver. There are lots of duties and responsibilities that they have to do um, while at work, but definitely they should not be allowing themselves to let the quality of care suffer. And this can only be remedied by proper scheduling and teamwork. Now, secondly, as per result, there should be acceptance and understanding of the basics of EOL care. And the second question is addressing the contribution of EOL care to the overall emotional health of the caregivers. So based on their responses, I came to conclude or say that there should be acceptance and understanding of the basics of the care. And if there are, or like if there's understanding and acceptance, then that would contribute to their overall emotional health. And number three, the sharing of feeling of sadness or grief. So I firmly believe that this is really common among caregivers to be sad when the patients pass, and whoever is in the same situation will be sad because given the length of time that they have spent with them, preparing meals for them, taking care of them on a daily basis, definitely they would have this experience of sadness or grief. So that question addresses how the caregivers cope against the loss of a patient. The caregivers answers vary depending on the level of maturity and closeness with the patient. So the next one is depression, anxiety, and fear. So this kind of depression is something that I just also would like to associate with, with sadness, but um, or feeling of loneliness. Anyway, they said that they could handle the job very well. But for the purposes of this research, so let me use that term. So depression, anxiety, and fear, and these are, I believe, normal feelings of everyone confronting deaths of their patients. So this addresses the question how their emotional health has changed following the death of their patient. And lastly, there is compassion, knowledge, love, skills, and patience. So this question identifies the qualities needed to succeed as end-of-life caregiver. Among the qualities mentioned by the caregivers, compassion emerged as most common among them. After undergoing the initial processes of the research, I finally concluded that there's is the relationship between EOL care and the status of their emotional health. And this conclusion definitely was based upon um, studying the results of the interviews. So it can be told, that it can be said that the emotional health of the caregivers are affected by the job that they do as hospice caregivers. So the experiences of the caregivers at Marshall Villas show the relationship, like I said, between EOL care and the status of their emotional health. So central to EOL care are the demands of the job. So obviously, as reflected in their answers, the job was demanding from patient care to communication with hospice personnel. These demands were deemed manageable through proper scheduling and teamwork. Otherwise, if not properly addressed, may add up to the emotional distress that they experience. And this is also what I have observed, just to add up to this thing, that indeed it is so stressing to be in this kind of work. If proper scheduling and teamwork will not be done, they will be so overwhelmed because functions are really a lot. So caring for somebody's final stage can be considered a different experience, and it requires acceptance and understanding and the recognition of the role of compassion and knowledge in order to succeed as EOL caregivers. Now, all of these things definitely do not happen overnight. So the caregivers at Michelle Villa were honest to admit the feeling of sadness or grief when their patients pass on. They too were cognizant of the fact that since there is a limit to what they can do, they can be prone to depression, anxiety, and fear. So overall, it can be inferred that end-of-life care impacts their emotional health, and interventions must be done that they can enjoy quality life as well as they perform their duties and responsibilities. So caregivers' emotional health is of paramount importance in the promotion of better quality of care for those in the end-of-life stage that administrators, licensees of residential care facilities for elderly should prioritize. Now here we come to the recommendations. So the very first recommendation is the provision of individual counseling services to the caregivers. It is very important given all the data that I provided that counseling be provided when necessary. Second, um, there should be the provision of end-of-life care training for the caregiver. Well, most of the caregivers are really trained, but um, given the data that I provided, it's highly suggestive that further training be given to the caregivers about end of life care. So each person is, or the needs of each person is unique. So they should be ready to fully understand the dynamics of EOL care. And then last but not the least, there should be the review of schedules of activities. And so that's recommended that the job duties and responsibilities be properly or equally assigned to the caregivers. Although most of the caregivers mentioned that they really did manage the demands, the schedules, and everything. But what I'm saying is that there should be a review that if this can be polished even more, then it should be done. This time I take the opportunity to share to you the learning outcomes, and I'm very excited to share what I have learned all throughout my journey when I was working on the research. So the experience was very meaningful to me because um, as a person who has been doing caregiving for a relatively longer time, I am excited to learn about new experiences. And this one, I learned to give hospice care a fresher look. So it opened the floodgates for new ideas and new insights. And I learned to look at the subject from different perspective. And should I say that that care is a shared responsibility between the owners and the caregivers themselves. So even if the owners of the facility care for you as a caregiver, if you don't care about yourself, then there would be a problem. So there should be a balanced approach when it comes to hospice. When it comes to hospice care, I am very appreciative of the effort that my professor um, shared in this endeavor, for the very good supervision that he did. And I truly treasure everything, and I'm glad that finally I come to finish the research work with, I believe would be beneficial not only to Mashalville but to um, all the facilities that um, admit hospice care patients or those in the end of life stage. Thank you. Again, thank you very much.